Knowing the signs and symptoms of brain metastasis is an important first step to advocating for yourself if you suspect that something is not right. Dr. Kumdekar explained the signs and symptoms of brain metastasis. And while these symptoms don't always indicate that breast cancer has spread to the brain, it is important to talk to your doctor if these symptoms persist for more than 2 weeks.
So when we think about the symptoms that brain metastases cause, I personally think of these in two sort of buckets. So one is the generalized brain symptoms that sometimes happen when there's higher pressure in the head from the brain mets. So these are symptoms like headache, nausea, vomiting. And then there are specific symptoms that are basically location dependent in the brain. So, as you can imagine, if you have a metastasis in the speech center, you can get speech issues. If you have a metastasis in your motor cortex, the motor part of your brain, or the sensory part of your brain, you can get respective symptoms related to that. Or in the walking and coordination part of your brain, your cerebellum, you can get symptoms related to that directly. One other symptom that we can see with brain mets or any sort of irritation to the brain surface or the brain cortex is seizures. And not all seizures look like big, generalized tonic-clonic seizures that you might see in TV or movies. Sometimes you can get smaller seizures like speech arrest in episodes or one side of your body motor seizures in focal motor seizure episodes. So these are all symptoms to look out for uh, when we're thinking about brain mets, or rather, when you see any of these symptoms, one should be evaluated for brain metastases.
The site of metastasis can have a substantial impact on a person's experience due to differences in physical symptoms and in treatment options. We asked Dr. Kumtekar to explain how a diagnosis of brain metastasis can impact a person's breast cancer experience.
As this audience probably knows, having brain metastases can impact you in so many ways. I would say I'll start with treatment management as a whole. So, when we're talking about brain metastases and we're talking about treatment for it, some of the medical therapy can actually not get to the brain because of something called the blood-brain barrier. Some of it does, though. There's a lot of newer therapies that do. And so that might make your doctor think about specific medications that are specifically designed for brain metastases. So there can be essentially a change in treatment based on the fact that you have metastases in this location. Another thing from a treatment perspective that might be different for you as a patient with brain metastases might be eligibility for clinical trials. So many of us run or participate in clinical trials around the country with brain metastases or breast cancer as a whole. Some breast cancer studies don't allow for brain metastases, some do. And so these are things that you're going to want to talk to your doctor about. And there are yet additional studies that are designed specifically for brain metastases themselves.